Der Forschungsschwerpunkt
The BiomaTiCS research focus program is one of 4 research focal points at the Mainz University Medical Center. The 3D lab we have set up here in the surgery center is designed to make 3D printing available for clinical applications. BiomaTiCS is short for Biomaterials, Tissues and Cells in Science. This research program at the Mainz University Medical Center combines basic research science and materials science with clinical and surgical disciplines to translate the findings from materials science into clinical application. The 3 research areas of BiomaTiCS are translational nanomedicine, vascular integration of biomaterials, and 3D printing, with an emphasis on 2 areas of application. One application is the creation of patient-specific 3D models, the other is the design of full-scale aorta models, enabling our students and technicians to practice specific procedures. These are techniques that facilitate the probing of individual arteries, individual branches of the aorta with guide wires and catheters, and testing the implantation of endovascular prosthetic grafts in this type of model.
In endovaskuläre Prothesen probeweise in ein solches Modell implantieren kann.
The template for this type of 3D model is made up of imaging data provided by CT angiography. Physicians use it to determine the structure they wish to print. However, this method cannot be used for all patients yet, since the printing process takes some time.
Derzeit verwenden wir es für komplizierte Fälle.
We currently use this process for complex cases, that being patients suffering from complicated diseases or complex vascular anomalies. The model is very beneficial in this case because it makes it easier to illustrate the anatomy or anomaly, plan the surgery, and, above all, explain the individual steps in an easier and more descriptive way to patients.
Die einzelnen Schritte auch besser und anschaulicher erklären kann.
Surgical planning and preparation is not the only area where 3D printing can be used.
Der 3D-Druck kann, und das tut im Moment,
3D printing can, and is already being used, to create implants in orthopedics, meaning for knee replacement surgery, or for use in maxillofacial orthopedics and dental implants, for example. Of course, there's also the future possibility to not only use the method for implants, but to produce living tissue, ranging from bone replacements to custom vascular grafts. This is part of the so-called bioprinting process.
Und das fällt in den Bereich des sogenannten Bioprintings.
Within the scope of BiomaTiCS, Professor Werner Muller and his team at the Institute of Physiological Chemistry concentrate on the bioprinting process.
Bioprinting ist ein Verfahren, wo man eine
Bioprinting is a process that combines bioink, biocompatible ink, with cells to create tissue structures with the aid of the computer. This computer-controlled tissue structure subsequently has the custom fit you ultimately need to offset a bone defect or tissue disorder, for example.
Zum Beispiel ein Knochendefekt oder ein Gewebedefekt auszugleichen.
Bioprinting has 2 advantages for medical technology. The production of a custom-fit implant requires the use of less material than is needed for fixed implants because the necessary components are built layer by layer using bioink. What's more, the used materials also promote a regeneration of defects inside the body.
Wenn wir was drucken wollen, müssen wir drucken mit Materialien.
When we print models, we have to use materials that are based on nature. We must not introduce materials that are rejected by cells. However, cells like polyphosphate. This was our breakthrough in this sector. We were able to show that when we embed cells in this material, they actively proliferate and continue to change from stem cells into somatic cells, for example.
Aus Stammzellen zum Beispiel zu fertigen Körperzellen. Polyphosphate is
a relatively simple material. It consists of units called phosphate, phosphate and phosphate. What makes them so interesting is that these phosphate units are linked by high-energy bonds, as is the case with our vital source of energy ATP. Our discovery for regenerative medicine, which I believe is quite important, shows that when the organism manages to split these high-energy bonds again, the energy is released and can be harnessed for processes such as bone growth or collagen creation, for example.
Diese energiereichen Bindungen wieder zu spalten die Energie wieder frei wird und nutzbar ist für Prozesse, zum Beispiel der Knochenbildung oder der Kollagenbildung.
The scientific and technological foundation for printed medical implants has been laid. That being said, the process still needs some improvements to ensure clinical application and ultimately approval.
Die Drucker, die solche Implantate herstellen.
The printers that produce these types of implants are already available, and they can still be improved, of course. You can make the resolution higher, but the real challenge is to produce the right bioink. To do this, you need polymers that must meet certain requirements. I believe we have taken on a pioneering role in this area by discovering and copying what Mother Nature does.
Und das ahmen wir nach.